Hi everybody, I'm Dr. Julie Doyle. I'm the Director of Netwalk Casala in Dundalk Institute of Technology. So our research centre focuses primarily on, I suppose, designing, developing and evaluating digital health solutions to support older people to age independently in the place of their choice. And we work primarily with older people and those who care for them to design innovative solutions. I guess in terms of the work that we were involved in ECME, I suppose our main objective really was to advance digital home-based care for older people with cardiac conditions. So we were very much focused on the home-based environment and focused on, I suppose, supporting self-management in the home. So, our objectives were really to work directly with older people with cardiac conditions and those who care for them to understand their needs and requirements. And I suppose we wanted to build a technology platform that would support this. We co-designed this with older people, with healthcare professionals, their family members. And I guess one of the key objectives then was to, I suppose, evaluate that platform and home-based studies with older people. So we focused on developing the platform to, I suppose, help people to monitor and self-manage symptoms and lifestyle related to cardiac conditions, using a mix of different wearable sensors. We developed and delivered digital interventions for cardiac rehabilitation and the management of condition-related anxiety. I suppose a number of key impacts really. I suppose we developed this technology platform, so obviously there's been IP output as a result of that, and it's generated a lot of rich research results, which we'll publish. I suppose we have engaged very heavily with stakeholders in the area, both from sort of healthcare and industry, and I think there's a lot of knowledge transfer there. So that's been quite a major impact. The training program I mentioned for the PhD students, I think that the PhD students have gained, really transferable skills from their work on a large collaborative EU project, and having that interaction with other partners. I think that will really hold to them and transfer out to both academia and industry as well. And I suppose another key impact of our work really is, the engagement that we saw from older people involved in our research and healthcare professionals. And I guess, it demonstrates that older adults are seeking, I suppose, well-designed, useful solutions to help them self-manage their care at home. And I think the level of engagement we saw with the technology in our studies really demonstrates a willingness for older people to be involved in digital self-management. Yeah, I guess overall it's been, it has been a fantastic project to be involved in. I guess the type of work that we do, it is interdisciplinary and needs to be interdisciplinary. You need a multi-stakeholder approach, to solve this issue of, I suppose, better cardiac care for people. So I think that, that involvement from the various different stakeholders across the project timeline has been, I suppose, has been key to the outputs that we've achieved. And I think, coming back to the PhD students again, I think, that level of collaboration that they've experienced with these different stakeholders as well will transfer out. I think, the solutions that we've developed are commercially viable. I think, we've developed, a good kind of proof of concept system now, and hopefully the next stage will be to take that further out into industry and see more impacts there as well.